Good afternoon, everyone, and welcome to Gentle Movement at Home. We are thrilled you're able to join us today at Friday at the end of the week. Today, I am joined by Sue Schellinck, who's an occupational therapist and a longtime collaborator and instructor for Pain BC. So super excited to have Sue back today. She's done one session for us earlier in the series, and can't wait to see what we have. Just a little note, I think as most of you know, Sue is not able to provide specific medical advice, but she can answer any questions about the session itself. And so we will have time at the end where you can put your questions into the Q&A, and I will read those to Sue and she will respond. You can access this, excuse me, you can access this recording later on either our YouTube channel or on our Facebook page. We're recording it, and just give us a couple days and then it'll be up. There's a little poll at the end. We just ask for your feedback. And for any help you need during this session, you can either email me or probably easier to just put your request in the chat. Next week, we have Sue is back with us on Monday at 1. Tuesday, Neil's back, and then Thursday, June 11th, Neil is also back, and all sessions are at 1 next week. So I will stop there and hand it over to Sue.
Hey, hi everyone. Nice to see those that have come back, and nice to meet some new people. I have had a little bit of a crazy morning, so I think we're going to start with just a couple little breathing. This beside me is my lovely daughter. I do feel the need to point out that she's not that much taller than me. Her chair is taller, and she is taller. She also, I didn't prep her at all for this situation. So everything that we're doing, I will be teaching her as someone who's brand new to the stuff that we're talking about today. Now, if you have just finished your lunch, or if you're watching this not live and you finished a meal or a snack, probably best to do some breathing and give it a second to get your body in the right frame. So let's just take some nice breaths. Now, we're not going to force the breathing. We're just going to make each breath a little bit longer than the last one, but very comfortable, very relaxed. And again, I'm doing this because right now that's what I need. And I know that when my nervous system gets really ramped up, that I just need to use my breathing to wind it back down. All right, you keep that nice breathing going, and I'm going to go into a little bit about setting the stage, as it were, for today's session. We want to set an intention. Now, I suggest that you set one for you. I almost always set the intention of fun, right? Or relax. Fear and joy don't go together. Worry and joy don't go together. So it's really good to come to this movement session with the idea that you're going to have a good, safe, fun time. If you are worried thoughts, if you're in a worried state or anxious, or your mind has some negative thoughts coming at it, and you do the movement, you know, you're still going to get the benefit of the movement. But if we can get that nervous system on board, if we can get that fun feeling going on, then the nervous system is going to also be in a really nice state. We want both the nervous system and both the muscles, the body, to have a really good session today. Now, I'm going to talk more about the nervous system perhaps than the body. Remember the breathing. How are we all doing? Again, don't force it. If you breathe too long, too soon, if you're forcing your breath to be long, then often we can get a little bit dizzy. So if that happens again, just go back to your regular breathing and then continue on. Last time we talked about awareness, we showed that little video of the dancing bear. And I want to bring that just to your attention, just to remember, when we are moving, we want to pay attention to our nervous system, right? We want to pay attention to the dancing bear, if you did see the video, not to the number of balls that were thrown, the basketballs. How do we do that? Our breathing, okay? So whenever you're moving today with me, if you find you're holding your breath or your breath gets short, then you want to just pause. If you're seated, you can just stay seated. If you're standing, just go back to a very simple move that you enjoy until your breathing is a nice state again. Also your muscles, if your muscles start to tense up, that's another good sign that your nervous system is ramping up a little bit. Pause, right? We're not stopping, we're just pausing. We're letting the muscles rest. Same with our thoughts. If a thought goes through your head like, oh, I can't do this, or oh, this is gonna hurt, right? That nervous system is ramping up a bit. We just want to take a little pause. And these pauses can be 5 seconds. They don't have to be 20 minutes, wind your whole nervous system down. Just pausing, right? All right, so gentle movement, I love the idea of gentle movement. I like to think of safe movement because we need to feel really safe when we're moving. If we feel safe in our bodies when we move, then it's way easier to have fun with moving and to have both the nervous system and the physical body benefit of movement. So how do you know if you're safe? How would you know if you're safe to move? If you had, say, a back injury, what's one way you could find out if you're safe?
Staying within my comfort level.
Staying with your comfort level. Yeah, that is really good, especially if it's an acute injury, right? Pain is meant to tell us to stop. Pain is telling us we're going too far. But with chronic pain, if your pain's lasted longer than 3 to 6 months, then your nervous system's getting overly involved, right? So staying with your comfort level is good for acute pain. For chronic pain, it's sometimes not a really good judgment. It's not a really good way to guess that. So we want to look for other bits. Of course, we don't want to push through the pain and have the pain so high, right? So staying a little bit within your comfort level, but more when you're thinking of your nervous system and how that's functioning, as opposed to your pain level, right? A really good way is to ask a healthcare professional. Ask one that you trust, ask one that knows about your body and your injury. A lot of people ask their GP, and what I suggest is say, am I safe to move? Almost always the answer that comes back is yes, and that's good. That generally means that the chronic pain that is there, the injury is healed, but the nervous system has kept the pain at a higher level. So that's excellent. But maybe a better question to ask is, what movements should I avoid? When you ask that question, you might get some answers specific to your injury from your GP or say a physio, or chiro, occupational therapy, but you will likely get the same, well, your pain will be your guide. Now, if your pain is your guide, again, that's really good because we're not going to distract from the pain, but we're going to focus our awareness, there's that word again, on our nervous system, and we're going to use that as our guide to how well we're doing. Clear as mud. I know that's old hat for some of you. It may be new for others, and if it was a little bit quick. But I just want to keep those things in mind, that we're going to have fun and we're going to be aware of what's happening with our nervous system. And we're going to feel safe when we're doing this. So how do we feel safe in the body? Well, posture is going to be a big important part. We want our bones to do the work. And what happens is there's some very specific things that happen to people in pain. And I covered them last time, really quickly going to go over them again. I'm going to get Sophie here to stand up and stand near the wall. All right, see, she is taller than me. What we want, and use the posture tricks that work for you. Minor suggestions, what works for you is great. A lot of people have that golden thread that they pull up nice and tall. That's fantastic. I'm not going to go through a whole posture thing, but some of the very common things that happen with the spine for people in chronic pain, we're going to go over real quick. One of them is the lower spine. So I've already asked Sophia if it's okay if I sort of manipulate her body. So I'm going to get you to move this way. Right. What happens for a lot of people in pain is that these buttock muscles, they tend to tighten up too much. And what that does is the bum then tucks under. Can you tuck your bum under a bit? Like just, can you tuck your bum under? Like that. Can you do it more? Can you be more obvious? Okay. So what happens is the bum tucks under, and that's because these muscles try to stabilize the back there. Now that's not great, because when that happens, instead of your hips being bending at the bending point, your low back is, and we don't want that. So what happens is, just stay there, love. Okay, what happens is when someone tends to sit down, they tuck their bum under, and then they sit down. Can you sit down, love? Right. Now she did revert back, and so I'm gonna show you what I generally see with people in pain is the bum tucks under, and they kind of do this kind of thing to sit down. Now again, you're loading, when you sit on your pelvis, you're loading your spine, and your spine is flattened, which isn't good. We want a nice, you can't see my curve, you want a nice curve to your back. So what you want to do, we'll get you to sit down again. So just stand like you're going to sit down. Right? You want to, yeah, you want the bum to go out, right? And this is when you're sitting. We'll get you to stand up again. Right. So again, really bend from your hips. We want to bend from here and have that bum really go far out and sit down, right? That's going to be a really safe position for your spine. So what you need to do is maybe relax these muscles just a little bit more if they're over tensing, and you want to engage pull your belly button into your spine, and that's going to help give you the physical support from your muscles, but also the bones are going to be in a nice position for that. All right, thank you very much. I'll get you standing. Okay, now for the neck, I'm going to get turning. What happens with the neck is that people who have sort of neck injuries, shoulder, arm, they tend to go concave a bit. So they can round their shoulders, right? And then their head tends to tilt up because they're curved a bit more, right? So they got that sort of bit more of a hunchback. You're too young and fit. There we go, which is beautiful. Hunchback, and then the neck goes up. So that's not great for here. And then when they go to raise their arms, so you lift your arms up straight up, right? They tend to lift through the shoulders first. So what we want to do with that, put your arms down, please. Fantastic. We want to think to pull nice and tall. We want to think to bring those scapulas down. Turn this way up, right? So lift your shoulders up. This is a very common state with the shoulders up. We want to think bringing those scapulas gently down, right? We're not bringing the shoulders back together. We can when we move, but not for a standard position. Great, thanks very much. Now I'm going to get you to sit back in your chair. We're going to talk a little bit about evasive stance. So what that means is when you're trying to create safety, there's a few different things you can do. Actually, can you face the front of your chair? Okay. Whether you're sitting in a chair or whether you're standing, I'm going to stand, right? There's a few things you can do. When your feet are a little bit further apart, that's a wider base. And we generally feel more stable. We can also do this in a chair. We can have our knees a bit further apart, right, and our feet sort of wider. So when you're going side to side, if you reach side to side in your chair, you're going to feel a bit more stable. So if you want to challenge yourself, you can bring your legs in a little bit more. You can even lift one leg if you want to do something and have a bit more of a challenge with that. All right. One of the things to remember when we're moving, also, to feel safe, is to make sure that we have some nice stabilization of our spine. And generally, the easiest thing to do is pull your belly button in just a little bit. It's about a 30% activation, so it's not too strong, but we want to engage that. What happens with people in chronic pain is they tend to, because the back muscles are so strong and overpowering in their support of the back, the front tends to not engage so much. So really gentle engaging in the front can help you feel quite a bit more safe. All right, so that's some tips for your body, except for I forgot the feet. We talked about the tripod last time, right? So remember that you've got those two spots right below your big toe, right below your little toe, and right in front of your heel. That's your tripod. So when we're sitting in a chair, you can still work on having your tripod all points equally touching. So no, not too much of the front, not too much of the back, and then side to side. We are going to do some walking, and when we do that, we do want to make sure that we're getting full pressure on all points. So heel, of course, when the foot goes down, we want to make sure both sides are nice and even, right? We step forward again. I feel very safe because I know that both sides are touching there. Now, what happens with people in chronic pain is they use their eyes too much for their balance, right? And so that all can bring on headaches. So you can have low back pain and you have the onset of headaches when you move too much. So if you know where your feet are when you're moving forward or backwards or side to side, if you're confident that your foot is there, that takes some pressure off of your eyes, and you can then sort of decrease the need of your eyes and decrease the headaches, which is kind of cool. It's kind of weird to get headaches with low back pain, but we do see it, or I see it quite often. So that's the body stuff. Now let's get the nervous system ready. Okay. Are we still breathing? I'm not. I'm talking. Right. So let's get the nervous system ready. So again, nice, long, slow, smooth breathing. Right. Lots of talk about breathing. I tend to suggest that you do what you feel fits with you, right? So in through the nose, out through the nose, some people suggest. I personally find that hard because of my facial anatomy. I can go in, but then I tend to breathe out through my mouth. Sometimes I breathe in and out through my mouth. So again, we want to do what's comfortable, safe, and fun. So if we're worried too much about whether our breathing technique is correct, then we're sort of losing that fun and that relaxation part of our movement. All right, again, our thoughts. We want to make sure that our thoughts are good, our thoughts are calm, and our thoughts are of safety. So the reason why I went over some of those physical things is so that you can really anchor your thoughts, I'm safe. So if you're doing a move and your pain starts to go up, you can think, you know what, I know my lumbar spine is safe, my cervical spine is safe, I know, and then we can breathe through that kind of stuff. Right. Now, I have a ready, set, go. Ready is the nervous system. We talked a bit about that. Breath, our muscles, nice and relaxed. We only want to use the muscles that we need to, not any extra muscles. All right, our thoughts and our mood. Now, that's the ready part. So that's the first thing you want to do is get your nervous system ready. Set. Look at your posture. Do some visualization, which we're not going to cover today. And do a final muscle check, because often our muscles will creep up, especially if we're a bit tense about moving, right? And then when we hit the go part, you're going to want to move slow. You're going to want to use your big muscles in your body, not the little ones. And you want to be really mindful of how you're moving. So ready your nervous system, set your body, go slow and have fun. Okay? All right, I think we're ready to go. So if you look at this a second time, you can probably just fast forward to this point, whatever point this is in the program. All right. We have a little puppy that wants to join us, but not today. We're going to start just a little bit of a seated warm-up. I'm going to do some standing stuff, and I'm going to get Sophia to mimic what I'm doing in a seated position. All right, so cat-cow. So I'm going to turn, you can stay. What we're going to do, we just talked about how important it is to have good posture, but again, we want to be able to have a nice fluid spine. Our spine is not meant to be rigid, our spine is not meant to stay in one place, right? So we're going to do a really gentle cat-cow. Now, we're going to first go back. You want to start with your pelvis, rotate your pelvis under, and then hold your knees if you want that, or you can hold on to your chair handles and just let your back curve. You don't have to go very far, right? You can look at just nodding your head down. So take a little bit back on your pelvis if you can, nodding your head down, or you can go a little bit further into that. Okay? Right. Your choice again, feel safe and have fun with this. I love moving my spine, it just feels so good. All right, yeah, good idea. So moving a bit more forward on your chair. Again, holding on to the sides if you like. All right, and then the same thing, you want to shift the pelvis back, arch. If you feel comfortable, you can look up a bit, but you don't have to. All right, so we're in cat now. Okay, all right, and then shift back. Now, what we're not doing is the breathing part, right? So I like to breathe in when I sit up tall. I feel like I have lung space, so I breathe in, breathe out. Breathe in, and breathe out. Now you don't have to do my rhythm. If your breaths are slower, feel free to move slower. If they're faster, feel free to go faster. And if this is too much, you just want to stop and do some visualization, that is absolutely okay. Good. All right. Now what I do, what I love is this one is a bit of a spinal twist. Now a key to this is keeping your bottom of your ribs and your hips far apart. You want to pull them apart. So sitting up nice and tall, but we want to keep our shoulders down. We don't want them to rise up. Put your hands on your knees. Pull your arm back to your hip and turn. Oh, that feels good. Look a bit over your shoulder if you can and come back. And then we'll go the other way. All right. Bring your hand back to your hip. Turn your body. Move your head with your body or turn it a little bit more. Always with breathing. We'll do a few more of these. Good. I like to exhale when I'm twisting. I feel like it's squishing all my air out. Keep going. Good. Now a trick you can use if you want to twist a bit further is look. You keep going. I'm going to talk for a second. You keep doing this one. When you pull your arm back, turn your head, but then turn your eyes a little bit further that way. Right? And then the next time you go to do that side, I'm going to repeat that side. Often you find you can turn just a little bit more. Your body will turn just a little bit more. You can turn your shoulders or keep them less turned. Okay, good. A couple more. Oh, that just feels so nice. So much sitting in this COVID time. So much sitting. And I find I need this one. You only need to do a couple of those. And to get that good feeling. All right, so now we're gonna do a little rolling. We're gonna roll in a bit of a circle. So what we're gonna do, again, you can put your hands on here, okay? And do as much or as little of this as you like, and you're gonna lean to one side. Good, lean more into that cow position, another side, and forward. All right, so again, you can stay quite rigid with this and just do a little bit like this, right? So here, my spine is staying quite rigid and I'm just doing a little bit of rolling. Right, holding on would be really good at the handles. That'll make you feel a bit more safe. Try to grip the handles, just have them there for balance. Or you can, if you can, do the more of the cat-cow with that. Okay, really good. Do that again at your own pace. And if this isn't something that's helpful, you can also just, you keep going, just sort of shift your weight from side to side. That's good too, right? We're done twisting front and back. We just need to do a bit of side to side. My favorite is these Sufi rolls. I love these. Okay, let's go the other direction. So I'll get you to the full Sufi roll where you do the whole. Right, there we go. And I'll just shift side to side, right? Always with breathing. All right. Okay, so let's just a little bit of shake out, right? Your legs, shake your legs, whatever kind of feels good. A stretch you might need. I need something behind my back. I have been sitting too long today. All right, this is gonna feel good. Okay, now I'm gonna be standing. If you feel like standing, that's great. If not, that is totally fine. If you feel like getting up and down, that also is totally fine. Some moves you might feel you're good to stand, others you might not want to. All good. I'm just glad you're here. All right, we're gonna start with some breathing and some arm movement. So we're gonna lift our arms out in a V. I'll turn this way a little bit and down. So you can see it's coming up a little bit. I love feeling like I'm breathing in tons of air and then pushing it out. Good, do a few more of these. Good. Good. try to make your arms feel just a little bit more effortless. They're kind of like they're just really floating. Like you're just using the least amount of muscles that you can to do this. And you can smile. We can have fun with this. You're so serious.
I'm nervous.
Oh, good. Oh, that feels so nice. Now, if you like that one, anytime we're doing anything else and you're feeling like it's a bit too much, just go back to that one or close your eyes. I often close my eyes when I'm doing these things because I can sense my nervous system better, right? I tend to distract from my thoughts. So if I close my eyes, sometimes they'll come in and give me an indication of what's happening. Because if you have a worrying thought that comes in when you're moving, it's not a bad thing. It's just an indication that your nervous system's ramping up. So then we do stuff to help it wind down because there's so much you can do with the nervous system. So many ways we can work with that to wind that down. We're going to do a little bit of twisting. We're going to do a little bit of turning the body. Again, feeling the arms. So you don't have to move your upper body. So you keep doing that. Yeah, right? You can just sort of move your arms back and forth. This is a little bit of a quicker one. If you want to match your breath to your movement, that's fine. So you can just do this with your arms, or you can just do sort of front to back on your leg, right? Whatever feels a little bit more comfortable. If you want, you can do a bit more of a twist, right? Because that feels nice. Again, keeping the ribs away from the pelvis. I thought about putting music to this, and I might on Monday, so be warned. Of course, this was going to be the twist, but then I thought, no. We'll see. Oh, and if you want, you can do a bit more free. So you keep that sort of more simple move going, if you don't mind. And I'm going to do this a little bit more. Now, if seeing me twist this much is not feeling great for you, then you can close your eyes and do the version which you like. You can even turn your head if that feels good. And again, this is fun, this is relaxing, this is safe. So whatever level that is for you is the perfect level today, and it might change tomorrow. Today you might be doing exactly what I'm doing, and then tomorrow it's a different day, and that is okay. Good, all right. Now we're gonna do some heel drops. So what that looks like is just letting your body relax. This is not part of it. I'm just letting my body relax. Okay, you're just gonna go up on your heels and down. Wings up, down. You're not going way up. I'm not going way up on my heels where I need balance. I'm just lifting my heels and down, right? Just a little bit of drops. This feels really nice in the body. And the thing about this, as long as we have good posture, right? Those bones in our vertebral spine, this is a really, really gentle pressure on them, right? Really gentle. And what that does is it releases synovial fluid. And the synovial fluid actually lubricates the joint because every muscle, every bone there that connects with a bone is a joint. And we want to make sure we've got some nice, good movement in our spine. So again, we've got Sophia, and she's lifting her heels up and she's dropping them. It is a bit of a drop. It's not an exercise where we're using our calf muscles necessary to raise us up and drop us down. It's just a little drop, just a little bit. Yeah. All right. Now this one I quite like. It's rocking back and forth on your feet, and this is quite nice. You want to stick your bum out on your toes. You can lift up your heels, although now I'm falling backwards, so maybe that's not a good idea. Right, so a little bit on your toes, a little bit on your heels. You don't have to go too far. Right. You might want to move to the edge of your chair just a little bit more. Move to the edge, right. And then just put some pressure into your toes, and then pressure into your heels. Get a little bit of rocking. Right, I'm going to get a little bit more going. Right. Get my pelvis into a little bit of swinging. But we need to teach our back that it's okay. It's safe to move. Right. There we go. And are you breathing? Sometimes when we do new things, we hold our breath. New stuff is really important to teach the brain this is safe. So make sure When you're doing a new move, you're breathing, because it's a really good sign to the nervous system that this is safe. I'm gonna shake that one out. Oh goodness. It's too much kicking. Good. All right, so now we're gonna do a little bit of movement. We're gonna work on that, the tripod that we talked about. So we're gonna take 3 steps forward, and then we're going to do a movement. So Sophia here is gonna lift her legs like she's walking. We'll do 4, and then she's gonna do the arms. And the arms are, from last time, the palms toward, right? The full one is up, right? The palms to the ceiling. We rotate the elbows back and down. Now, we're gonna go one more time. I'll show you from the side, and then we're gonna modify it, okay? So again, palms toward you, all right? Palms to the ceiling, elbows go back as far as is comfortable for you. Nice opener here, and then all the way down, okay? If overhead is too difficult, or if it might be bothersome for you, if it's not fun, we can change it to this. Go up here, palms out, and down, right. Palms together, palms forward, and down. Okay, so that's the one I'm gonna do. I'm gonna combine it with walking. And Sophia's gonna take 4 chair steps, and then she's gonna do the big arms, okay? All right, so 1, 2, 3, 4. We'll do a few of these. I like this one. The other thing, shoulders tend to lean forward quite a bit. When we're sitting too much, our shoulders roll forward. This is a really nice one to roll those shoulders back. You might find that you need a few before you can really roll them back though. All right, I'm gonna take some steps back. 2, 3, 4, good. Then we're gonna do the opposite one. We also did this one last time. In the full one from the side, your arms, your palms are up. You're gonna go up to the ceiling, back a bit if you want, but if you don't, that's okay. Up, and then straight down. Good. So again, we're gonna modify it in a second, but this right, good, and then straight down. What I'm gonna do is I'm gonna do up to my shoulders. So again, we want the elbows below the shoulders. That keeps able to keep our scapulas down. When you do go overhead, make sure you're not leading with the shoulders. Make sure the shoulders don't go up first and then the arms, right? We want to make sure the shoulders are down gently, gently, gently. And then the arms go up. So I'm going to do where I go up like this and then forward and down. So let's do a few of those. Breathing in.
I go all the way up.
You go all the way up. Yes, please. Thank you. And down. Breathing in. And down. Breathing in. And down. Breathing in. And down. All right. So let's combine those two. We're going to step forward and we're going to do 2 arm circles, and then we're going to walk back and do 2 arm circles the other way. All right. So 1, 2, 3, 4. Oops. Remember your feet. Where's your tripods? Another one. Just gonna put this down. Breathe in. Oh, elbows up. That feels so good. And then 1, 2, 3, 4. And then we go the other way back. Good. Shoulders down. I think my elbows were too high that time. All right, breathing in. Good. Okay, now we're gonna go forward. 1, 2, 3, 4. Breathing in. One more. Good. 1, 2, 3, 4, and palms up. Palms up. And another one. I think one more since this feels so nice. Okay, 1, 2, 3, 4. Palms towards you. Push. Good. Palms towards you. Palms towards you. Good, and back. 1, 2, 3, 4, and up. And up. Elbows down. Belly button in. Breathe. All right. Oh, that feels so good. A lot more of that on Monday, so that's going to be a lot of fun, right? This time we are going to walk sideways. Okay. So first we're going to start by doing side to side. Now, if you are standing and don't feel like going to side, you can always just sort of stand in place, right? Do little steps that way, right? Little shifts. That's totally fine. Or you can bring your feet together, take a step, right? Right. And so what are you going to do you think?
Move my feet up and down again.
Yeah, and you can maybe sort of move them inch them to a side a little bit, maybe turning your body as you go. Yeah, whatever feels good, right? Whatever feels like it works. Okay, so I'm going to stand over here. All right. So 1, 2, 3. Then we're going to bend our knees. If you're standing, remember the bum goes out, the knees are bent. Right, then we're going to do punch out, and out, and out, and out. Good. All right, and then the other way. And this time we're going to go side, inside. Oh, and the breathing. I know, is this one good?
It's good.
1, 2, 3, out. And this one you can do a bit of a twist if you want, or you can just have it straightforward. You might want to, in your seating, do a bit more of a twist. There we go. There we go. Good. And the other one. 1, 2, 3, and there. And again, you can just have the arms going like this. So if you'll do a full twist with your body, and just do the arms there. Right. Oh, I'll just do one more of those.
Okay.
I like those. 1, 2, 3, and then we're just gonna reach forward. You can keep your body normal, or you can do a bit of a reach if you want. There. Oh, whatever feels good and nice for you. All right. And back this way. 1, 2, 3. Oh, this way first. Oh, it feels so good. All right. So this time we're actually going to cross our feet in front and behind. So again, you can do step to step, side by side if you want, if that works. You could stay in one place and just move your feet. Or, I'm going to back up a little bit, you can cross your leg forward and then back. Okay. Now, if you keep your hips facing forward, it's there's no twisting involved. It's a little bit harder, especially going backwards. And you don't have to do a big backwards like that. You can even just put your foot just behind and there and just forward and there. You don't have to cross your legs. So lots of ways that you can vary this. All right. So I'm going to go that way first. All right. And you can just put sort of your feet in front of each other like that if you want. Okay. Yeah. Yeah. I was thinking just one in front of the other. Yeah.
Okay.
I mean, whatever feels good, right? But if you
That
want
felt
to,
better.
does it feel better? Yeah. So you can just do one in front like this, or you can just sort of put them on top like that. I know we can't see her feet, can we? They look beautiful. All right, let's go this way. So in front, behind, right. And then we're gonna do some swirly arms. And again, you can get your body going into this if you want. Slow it down. Or we can just do some mostly elbow work, whatever feels good for you. Okay? And go back, behind, in front here. And let's do this. Good. Move my body. I'm just going to do little wiggles. Nothing right, nothing wrong. I just kind of feel wiggly. I do. I've been sitting too long.
It's a great way to describe it.
It is. It's wiggly. I'm feeling wiggly and I need to wiggle. So that's definitely happening. All right, let's go this way. Good. Some crossing. All right. Now let's go the other way. Ooh, let's go this way. Just let this feel so nice. Bend your knees if you want. If you're standing. Right. All right, and back again, that crossing. You can twist your body if you want. I wasn't. All right, and let's go this way again. I want to say wipe on, wipe off every time I do this, but
I was thinking wax on, wax off.
oh, it is wax on.
Yeah. That's what I was thinking before.
I was going to ask you if you got that joke and you corrected me. Whoops. Oh, well. There we go. Okay, now that we've been using our arms, we're going to do a really fun one. This is called Serve the Dish. All right. Hard to modify, but we're going to give it a go. We start with it like this. We're going to go out. So we're going to pretend that we have a dish on our hand, right? And we're a fancy waiter at a fancy restaurant. And we're going to go out. We're going to go over our head. I know. Okay. And then we're going to have to lean because we're going to go behind. And then we serve the dish. Ooh, right. Okay. So let's try it again. Okay. We're going to go over our head. Oops, sorry. And then don't spill it. Behind here and then serve the dish. Okay. So we'll do that again. You can also, if you just want to, sort of do this kind of thing, right? That's a different serve the dish. All right. We're getting some turning. That's the kind of movement we want. If we don't want to go overhead, this is totally good. We're getting that nice, ooh, is that the robot dance?
Something
Yeah.
like
Oh,
that.
Egyptian. We're doing the Egyptian. Okay, next time, that's Monday. All right, so modify how you like it. I will do the full version because I think you probably got it, but it's a tougher one. Okay, so let's go. Oh, spill the dish. And I love this one so much.
So just like that. You're doing this way?
Yeah, sure. Yeah. Or some version of that, and play with it. You might start with something a little simpler and you might find that you're able, bend your knees. This is a bit more of a body workout than you think it is, this one. And remember, this is new. Hopefully this is new for you. Ooh, if it's not, can you send us a picture of you serving this? If you were a waiter that did this, that would be so cool.
I'll do this at work next.
Yeah. Right? So this is new, this is different. This is where we really have to let the breath and the muscles and everything relax. And now, for the grand finale, almost, both. Oh, I'm hearing cracking in my shoulders. That is okay. That just means that my ligaments have not been stretched. And then backwards. I didn't say this before. I think I can do it.
I got lost.
It is tricky. All right, let's try that one again. Open, yep. Over the head. Oh yeah, double cracks for me. I need. Oh, I needed this arm stuff. That felt so good.
I'm gonna not get lost this time.
Well, I might. And then I think I did it backwards. I did it backwards.
I need to practice.
Oh, all right. So give yourself a little bit of a shakeout. Hopefully that get the wigglies out. All right, and we're going to leave you with sparkly eyes. Now, sparkly eyes is a lovely way to sort of refreshen yourself. So it's after lunch, you had a little bit of downtime, and you can do this anytime. You want to take your knuckle, I'm going to get a little closer, so just your knuckle, right? Be very gentle. Please do not push very hard. You're going on your bone. So basically you're going to start here and come a bit closer. There we go. And you're going to go over your eyebrows, right? And then you're going to go under, right? So you're always on the bone. We're not going into this part here on the bone. And then you go all the way around, right? And then we do it again. Do it as long as you feel like you need it. I'm going to do one more. There we go. Okay. And then down your nose. And go up and down your nose a couple times. Not as quite as good as a cup of coffee, but maybe a little bit. All right. Now, that were some different moves. We incorporated some moves from last time because I didn't want to challenge your system too much. But let's end with some breathing, right? A little scan through your body. I know you've done lots of them through this program, and they're all good. Do the one you want. I'm going to start with my face and make sure the muscles are relaxed, rested. You're not trying to hit relaxed face. That's a hard thing, but if you can just rest the muscles of your face, that's good. Let the shoulders rest. I always find I have to move my arms a little bit before they rest. It's like I'm shaking the tension out of them or something. And let them rest. Torso, legs. Congratulate yourself for showing up today. Whether you did all of this or just some of it, you're here. That's great. Hope you had fun, and I hope you feel good. Is there any questions, Jen? I would love to answer them.
Yeah, well, here's the poll, so everyone can just take a minute and put their feedback into the poll. That would be awesome. Sue, I enjoyed that. I enjoyed the sitting cat-cow, I have to say. I forget sometimes that I always think I have to go down on all fours to do that, and I forget sometimes you can just, you know, you can just do it in the middle of the day at your desk or when you're watching TV.
And the one I love is this one, right? I find that because I do have low back issues at times, and I find that that's the one that really kind of gets them to release, because my muscles get so tight and tense. And the cat-cow's good, but sometimes it's the twisting one for me that kind of releases them more. I love that one.
Yeah, a combo of those I think feels really good, especially well, you know, for someone like me, and I think for many of us, especially during this time where we spend a lot of time looking at our computers.
We do, and you know, it's hard because we don't have those little walks. We don't have the walk to the car. We don't have the walk from the car to work or to our friends or to. We just have our time in our house, and so it's hard. It's hard to be standing all that time. Yeah.
Yeah.
When there's so many seats to sit down on.
Good. Yeah. So thank you for that. I don't think we have any questions. None are coming in. And thanks, Sophia. That was really great that you were able to assist. We appreciate it. And thanks to everyone who joined us today. Also great to see everyone. And Sue, we will see you again on Monday. Sophia, are you going to join us then as well?
Going to work, yeah. There's going to be some music involved, and there's going to be some moving involved on Monday. We prepared you today for Monday, so it'll be fun. I'm not sure which child will show up with me.
Who would you read? The boy.
Thanks for having us.
Sorry, my my video has frozen.
Okay.
Anyway, I think that's a clue that we'll wrap it up for today, and we'll see you on Monday. Thanks, everyone. Have a great weekend.
Have a great weekend.
Bye.
Bye.